Hello, I'm Dr. John McDougall. I'm a medical doctor, and I've been on a mission for almost 40 years to help people regain their health by changing their diet. I run a 10-day live-in program in Santa Rosa, California, and you can learn more about my program on my website. Welcome to the series Star McDougallers in Their Own Words. I'd like you to meet Don. He regained his lost health, and he wants to share the message with everybody.
I was always overweight. I was always sluggish. I could never really do much in running, any of these things. So I would never really say I was healthy to the point that I am today. Probably the worst point when I was told that I had a silent heart attack. That was the pinnacle of knowing that I had a real problem. 5-6 years ago, when I was taking a regular blood test from my doctor at the time. He said it showed up in the blood test that I had a heart attack, so then they went into the normal routine test and everything, and it showed that part of the heart had been damaged. I remember when I started running, I have a small pool in my backyard, and I would try to jog around that pool, and it was not easy just to jog around the pool. And slowly I got around the pool twice, and then I kept on working on it. It was 4 laps, and then slowly bringing my, I guess, energy level, endurance level up. But no, I was very sluggish starting out. They did the treadmill test, and so signs showed up on that. And then they did the test that they put the ink through your system and check out the heart. And then they did the other one, which definitely showed the arteries being clogged, where they go into the groin and go up with a little camera. And it showed one artery was 95% clogged, and the other two were like over 50% clogged with it. And that's when they recommended triple bypass, and if not that, then stents at the least. I remembered this one doctor called McDougall, John McDougall, yourself, from years back over in Hawaii when I saw your commercials, and I knew that some pilots were coming up here to take care of their heart problems, or else they couldn't fly anymore. So I said, well, let me check it out. And I knew you were at St. Helena's at the time, but when I checked it out, you had moved over to here, to the Flamingo here in Santa Rosa, and the timing was perfect. Like someone had scheduled this for me. I got the bad news. Less than a week later, I was up here at your clinic for a 10-day clinic. And in 3 days, my energy level totally changed. It just increased. And I was feeling so much better by finally eating the foods that I guess I really needed. Because I was born a vegetarian. I've never eaten meat in my life, not animal, not seafood, not chicken. And the doctor said it was a good thing I like dairy. And dairy is what, I guess, did most of the damage in a non-athletic, because I couldn't breathe that well, non-athletic lifestyle. And so I was in between the zone diet and a few other diets that one would say no beets, another one would say no bananas. So I wasn't eating that, and no potatoes. And when I came up here, I was eating potatoes. And I was eating other foods, and my energy level just perked right up. Even friends of mine back then, business associates, said, Don, you're dragging. What's wrong? Are you okay? They're looking at me, and I'm going, oh, my God, am I that sick? And after this, I just can't tell you how many business associates to friends have seen just a world of difference. I was weighing in about 230, 235, so I lost about 60 pounds, 55, 60 pounds. My cholesterol went from, I guess, mid-200s. Now it stays between 120, 150. And my blood pressure, I no longer need blood pressure medications. All the meds that I was on from my cardiologist have now all stopped. The Plavix, all of these things. That's what pays, the money I spent on the drugs is what pays for my trips up here. So I tell people that my trips are paid by the pharmaceutical industry. I do more today than I've ever done. And if there's one complaint from my friends or my other half, it's I've got too much energy. I don't stop. I mean, I'm constantly 12-hour, 14-hour days is not a problem for me. For going out, you have to be selective. But for eating at home, it's the simplest thing that there is. I mean, coming up to the 10-day clinic, learning how to cook, coming up to these weekends, seeing all the chefs. The one that you had today was fantastic. She was very basic, and she really showed the basicness of putting foods together. And all I need to do is be able to visualize it, and then I can take it home with me. And that's what I've been learning. So through your weekend seminars here. And I don't force it on them. I don't do anything. I just said, if for some reason your immune system is down, I said, that's what this diet does. And my interpretation of everything that you do is that you allow people like me to have an immune system that runs at its optimum. And that's what I preach more than probably anything else. I don't particularly say I'm a vegetarian or a vegan. And what kind of diet, when they say, what kind of diet are you on? I'm basically saying I'm on a diet that allows my immune system to operate at its optimum. And that's kind of, and then they say, well, what kind of diet is that? And I said, well, it's a McDougall diet, a vegan diet. And they said, who's McDougall? And then I go into all of that. So I think I've written out your website at least 10,000 times. So it's, and a lot of people are now on it. I've had just people in the last 2 weeks, 3 people who are on your diet. It's just they've had heart problems or they've had diabetes, and they're really improving so much that their doctors. The comment is the doctor says it works for you. That's good, and if they want to leave it at that, then fine. But I didn't see their body being anything different than anyone else's body. So it works for a lot of people, but you just got to be able to do it and understand it works the best for you. I don't have an MD, a regular doctor. I mean, I'm a regular doctor, but I'm seeing a specialist for thyroid just to make sure my thyroid's working properly. And that's about it. The one thing that I can't stress enough is that it's one thing if you don't want to do it for whatever your reasons are, but at least give your children the opportunity to understand this and to know what whole food does. See, I don't even like to use the word vegetarian because there's so many images that are projected. And like you brought out one time, you can drink Pepsi and eat potato chips and you're a vegan. So I don't like to use that word. I just like to say, get your kids to understand what whole foods are and the trouble foods that are out there. And when I see a parent putting Pepsi in a baby bottle, I'm stopping them. I have to say something. I cannot allow that, the amount of sugar that little 10-pound body is consuming. So that's the point. Even if though you want your steaks and prime ribs and lobsters covered in butter, fine. You're an adult. At least give the children a chance to understand what whole food is and what it can do for them. So that's basically one of my main drives.
Like many of you, Don's life was basically over. He was medically disabled. He couldn't walk. He couldn't function. He couldn't enjoy life. He was living his life in the doctor's offices and, threatened with some very, very serious treatments, heart disease treatments. And so he decided to change his diet. And what happened is what happens to basically everybody who changes their diet. I mean, this is fundamental, folks. It's just like people who quit smoking. All of them stop coughing and wheezing. I mean, they get healthy. And, people who are hardcore alcoholics, they quit drinking. And what happens? Not just a few of them get better. All of them get better. And you should expect the same with dietary change. It is so fundamental. It is so basic that you should expect dramatic results. You should expect recovery of your intestinal problems. You should expect your blood pressure to go down, your cholesterol to go down, for you to start feeling well, to get out of the medical businesses. Because, of course, most people are involved in these businesses with doctors and hospitals because they eat all this rich food and they get sick. Now, when you get well, you might develop the same problem that Don and I have, and that is we just want to tell everybody, We look at our friends and relatives and we see them suffering. We go, this is entirely unnecessary. I mean, it's just a matter of learning to like other foods that are even more delicious. You feel like going up to people and shaking them and say, hey, just change your diet. Well, I encourage people not to resist. Once you learn this, especially once you're a good example of what dietary and lifestyle change can mean, like Don, then you have the right to tell your friends and relatives, to help other people. And then you'll know how good I feel. I'm the luckiest doctor in the world because my patients get healthy. You help a friend or relative. You give them this very simple message. You watch their life change, and they will thank you forever. And that feels so good. I'm Dr. John McDougall.